Hello, everyone, and welcome to today's webinar. We are excited to have you join us as we explore how Zoho Writer can transform healthcare documentation. I'm Jennifer, your host for today's session, and with me is Gautam, my co-host. And Gautam, great to have you here.
Thank you, Jennifer. I am really looking forward to this session. Healthcare professionals handle a vast amount of documentation daily. Patient records, reports, invoices, research papers, and more. Keeping all this organized, secure, and accessible is crucial for ensuring efficiency and better patient care.
Absolutely, Gautam. And that's exactly why we are here today, to show how Zoho Writer simplifies healthcare document workflows. Our session will highlight how Writer helps medical professionals streamline tasks, maintain compliance, and improve collaboration across teams.
Yes, whether you're a doctor, nurse, medical administrator, or researcher, Zoho Writer can help you automate tedious paperwork, securely store and manage medical records, and collaborate with the right people, all while ensuring compliance with industry standards.
So, Gautam, before we dive into the section, can you walk us through on today's agenda?
Of course, Jennifer. We have a well-structured session planned today. We'll begin with advanced document formatting, showcasing how healthcare professionals can create well-structured and standardized documents effortlessly. Next, we'll explore powerful editing and collaboration, focusing on how medical teams can efficiently review and finalize documents with features like track changes and restricted comments. We'll then move on to streamlining data collection with fillable forms, covering key use cases like patient admission and scheduling, and setting medical lab reports for approvals, ensuring a smooth and efficient data collection process. In automating healthcare documentation, we'll demonstrate how Writer can automate tasks such as sending out weekly medicine orders to pharmacies, generating invoices, and creating discharge summaries using our pre-built templates and formulas. We'll also take a look at research paper writing, where we'll highlight Writer's advanced formatting capabilities, including citations, cross-referencing, and bibliography management, making it a powerful tool for drafting well-structured medical research papers. Finally, we'll go over the key benefits of using Writer for healthcare and wrap up with what's cooking, where we'll give you a sneak peek into upcoming features designed to enhance your experience even further.
Thank you, Gautam, for setting the pace for today's webinar. So now let's start with our first section on advanced document formatting. So Gautam, can you tell us why formatting is crucial in healthcare documentation?
Absolutely, Jennifer. In the healthcare industry, documentation needs to be clear, structured, and compliant with specific standards. Whether it's patient records, medical reports, or research papers, properly formatted documents ensure accuracy, professionalism, and easy readability. Writer provides powerful formatting tools to help medical professionals create standardized documents efficiently.
That makes sense. Now let's talk about custom templates. How does this feature help healthcare professionals?
Healthcare institutions often work with recurring document types such as patient intake forms, discharge summaries, consent forms, and lab reports. Instead of recreating these from scratch, Writer allows users to build custom templates, ensuring consistency and saving time. These templates can be predefined with common details, reducing manual efforts and making documentation more efficient.
That's a great way to maintain uniformity. Now, usually medical reports and patient records often contain structured data. So how does Writer handle table formatting?
Well, Writer offers robust table formatting options to organize critical data like test results, medication schedules, and patient history in a structured way. Users can customize table layouts, merge cells, and apply predefined table styles to ensure information is presented clearly and professionally.
Okay, so we just saw how templates help maintain consistency. But here I have a question. What if users want to apply their own branding and formatting across multiple documents?
Well, that's a great question, Jennifer. That's where custom styles and themes come in. Writer allows users to define text styles like font size, and spacing and apply them across the documents. Plus, they can set a default style so every new document automatically follows their preferred format. For even a professional look, Designs in Writer offers preset layouts, colors, schemes, and fonts. Users can select a predefined theme or even create and save their own theme for future use.
That's a great way for text formatting, Gautam. But structuring a document is equally important, right? So, how does Writer help with organizing large medical documents?
Well, Writer provides page layout tools like margins, orientation, and multi-column formats, making it easier to design medical reports, invoices, and research papers in a professional way. For more control, sections allow users to divide documents into separate parts with different headers, footers, and numbering. This is particularly useful for reports with multiple sections like patient history, research documents, and lab results.
So that means user can apply different layouts while maintaining a unified style.
Exactly. Combined with custom styles and themes, this ensures that documents are both visually consistent as well as well structured.
Okay, got it. So now that we have covered formatting, let's move on to how Zoho Writer helps healthcare professionals collaborate efficiently on documents. So, in a medical environment, multiple stakeholders often work on the same document, whether it's reviewing lab reports, verifying prescriptions, or finalizing patients' discharge summaries. So, Gautam, can you give us an overview of how Writer enables seamless editing and collaboration?
And in healthcare, collaboration is key. Doctors, nurses, pharmacists, and hospital administrators all contribute to different documents. Zoho Writer ensures that everyone can work together efficiently while maintaining control over sensitive information. Features like restricting editing, comment visibility controls, track changes, and image annotations help streamline collaboration in a better way. Let's take a look at these features in a close manner. And
Okay, Gautam. So I have a use case. So let's say a junior doctor prepares a treatment plan for a patient, but only the senior doctor should have editing access, while nurses can add comments, which can be viewed only by the senior doctor. So how can writer help control who edits and who comments?
well, that's where restrict editing and comment visibility come in. With restrict editing, you can lock specific sections so that only authorized users can modify them. For example, a treatment plan can be edited only by a senior doctor, while nurses and assistants can view it but not make any changes. Similarly, comment visibility is another great feature where it ensures that sensitive discussions remain private. Let's say an internal review is happening between doctors, their comments can be hidden from administrative staff or external stakeholders. This level of control prevents unnecessary exposure of sensitive discussions.
That's a great way to control document access. But say if multiple healthcare professionals are working on a medical report and we need to track who made what changes, how can writer help with this?
Well, for that, we can use track changes. Every edit made to a document is highlighted and reviewers can accept or reject modifications. This is especially helpful in lab reports, discharge summaries, and research papers where accuracy is critical. For example, if a junior doctor prepares a patient's discharge summary and a senior doctor gets to review it, suggest modifications, and approve changes. And these operations can be done using track change, all without losing the track of the original content. This avoids unnecessary back and forth and ensures that important edits are reviewed before finalization.
Okay. So, adding to this, in medical documentation, images play a crucial role. Like, for example, X rays, MRI scans, and lab test visuals need to be included in reports, right? So, how does Zoho Writer handle this?
Well, Zoho Writer allows easy insertion of medical images while also enabling annotations. This is particularly helpful in radiology reports or case studies where doctors need to highlight any abnormalities on an X ray or add observations on a scanned report. For example, if a radiologist wants to provide feedback on an MRI scan, they can simply insert the image into the document, draw annotations directly on it, and add notes, all within the same document. This eliminates the need for external tools and keeps everything in one place.
That's a fantastic way to improve medical documentation. Now, moving to calculations, where hospitals often generate invoices, calculate medication dosages, or track patient vitals. Does Zoho Writer support such calculations?
Yes, Jennifer. Zoho Writer comes with built-in formulas that allow real-time calculations directly within the tables. This is incredibly useful in medical billing, pharmacy calculations, and even patient monitoring reports. For example, in an invoice, Writer can automatically calculate total charges for the lab test, consultations, and procedures, applying tax and discounts dynamically. Similarly, a pharmacy log can use formulas to calculate total medication dosage for a patient based on weight and frequency of administration. With various formatting options like currency conversion, rounding, and percentage calculation, Writer ensures that all financial and medical calculations are accurate and error-free.
Now that we have seen how Zoho Writer makes healthcare collaboration seamless, from editing and approving medical reports to sharing visual insights and automating calculations, now let's move on to the next section where we discuss how fillable forms can streamline data collection in hospitals. So, Gautam, in healthcare, data collection is crucial. From patient registrations to medical history and consent forms. So, how can Zoho Writer's fillable forms help healthcare facilities simplify this process?
That's a great question, Jennifer. Zoho Writer's fillable forms allow hospitals to digitize their data collection process, eliminating the need for paper-based forms. These forms can be embedded directly into their hospital websites, allowing patients to register online, book appointments, or provide pre-consultation details before their visit. For example, a new patient visiting a hospital website can fill in their basic details, name, contact, medical history, and insurance details before stepping into the hospital. This helps front desk staff reduce wait times and focus more on critical tasks. These fillable forms are easy to design with drop-downs, checkboxes, lookup fields, and file upload options, making them a versatile tool for hospitals. Plus, all submissions can be stored securely in Zoho WorkDrive or linked to Zoho CRM or to a sheet file, ensuring seamless patient data management.
That's a fantastic way to simplify patient registration, Gautam. So now let's take this a step further. Imagine a healthcare facility wants to streamline the patient onboarding process by allowing patients to book appointments and provide necessary details, including their insurance status. Additionally, if the patient is an existing patient, then their details should be pre-filled automatically based on their patient ID, which reduces the need for repeated data entry. This ensures a faster and more seamless onboarding process. Now, how can Zoho Writer help hospitals automate this process while ensuring a smooth experience for both patients and the hospital staff?
Well, that's a great use case, Jennifer. Zoho Writer's fillable forms make this process incredibly efficient. For new patient, they can simply fill in their personal details, insurance information, and preferred appointment date through an embedded web form. But here's where it gets even better. For existing patients, the system can autofill their details by pulling data from a connected source like a Zoho CRM or a patient database in a sheet file. This eliminates redundant data entry, saving both time as well as effort. So let me quickly show you a demo on how to configure and achieve this use case that we talked about. So here is a template that I've created from scratch in Zoho Writer. So this is a fillable template and we have added fillable fields into the document. So here you can see that I've added a drop-down field which has got existing patient or whether it's a new patient. So once they enter these details, I have added a condition. So if the patient's status is an existing patient, I want a certain set of fields to be displayed. If it is a new patient, I want different set of information to be displayed. So why I am displaying this is I am connecting a data source which contains the existing patient's record. So I've got the patient name, their insurance details, and other information in my database. So based on this information, whenever the patient enters their admission number, which is a unique identifier, they'll be able to pull out the remaining details so that they need not manually enter the data each time they visit or each time they try to book an appointment with the hospital. So for this, what I'm going to do is I'm going to add lookup fields into the document. So to add in a lookup field, you have to get into the automate tab, and here you can check on lookup field. So if you're not able to find this field, it's just that you have not connected a data source. So just go ahead and connect the data source, and once it is connected, you'll be able to find the lookup fields. So you can enter this lookup field and you can choose whether it's a text field or a drop-down field. So if it is a drop-down field, all the patient admission number will be listed to me whenever the user types in the fillable document. So I'm just using a text field in this case, and I'm configuring this field into a table. So now whenever the patient enters their admission number, I want the remaining details such as first name, phone number, email address, insurance provider, policy number, group number, etc. to be automatically filled. So for that, what I'm going to do is I'm going to insert another lookup field, and in this case, I'm going to use patient admission number as a watch field. So watch field is basically the field that I have added. The first name will be looking out for the patient admission number. So based on the patient's admission number, all the details will be automatically pulled. So this is how you can configure a lookup field. So now, once this configuration is done, what I'm going to do is I'm going to configure the fields for the new patient. So if there is a new patient getting into the hospital, we'll not be having any existing data. So for that, I'm going to ask them to fill in the details and then upload certain medical documents such as insurance ID cards or maybe a medical report or even a previous the prescriptions into the template. So for that, I'm using a file upload field so that they can go ahead and upload it. And furthermore, I'm going to use lookup fields to schedule an appointment with a particular provider. So in this case, what I'm going to do is I have a providers list in my sheet as well. So these are the providers' name and their department that they belong. So for that, what I'm going to do is I'm going to use a lookup field called department, and I'm going to use drop down so that only the departments that I have listed in my data source will be available for scheduling an appointment. So furthermore, I'm adding another field called specialization, which will watch the department field. So here you can see that this is also a drop down and it will watch the field department. So based on the department selected, all the specialization under this department will be listed out. And finally, I am listing the provider's name, which is also a drop down field, and it will be based on the specialization that I am going to select. And furthermore, I have added a date field. So once this configuration is done, all I have to do is I can simply go ahead and send this form out to my patients, Or if I'm going to embed this in a website, all I have to do is click on publish and embed and click on public on the web and generate the embed code and simply put it into my website. So now let me show you how a patient will access this form and how they will go ahead and submit it. So now let's just take the first scenario, which is an existing patient. So I am selecting existing patient in this drop down. And as you can see, I am asked to enter only the patient's admission number. So now I'm entering the admission number. So here you can see once I entered the admission number from my data source, that is the database of the patients that I have, all the information along with the insurance details is being filled out automatically. So the user has to just fill out the remaining fields and then go ahead and submit. So now what I'm going to do is I'm just going to select the department in which the patient is looking for an appointment. So let me select neurology. And under neurology, I have two different categories, and I'm going to select any one of them. And as you can see, the doctor is also automatically selected based on my data source. Now I can simply select the required date of my appointment and go ahead and submit this document. So if it is a new patient, whenever I select the new patient, only the fields specific to new patient will be listed, so that it will not list any unwanted fields for the particular patient. So they can go ahead and fill these details and select the required department and doctor and then go ahead and submit. So this is how you can easily collect data and then use it for scheduling appointments for your hospitals.
That was a great demo, Gautam. It was truly enlightening on how Zoho Writer simplifies patient onboarding, making the process seamless for both new and existing patients. Now let's move on to another critical aspect of healthcare documentation, that is approving medical lab reports before they are shared with patients. In most hospitals, lab technicians generate reports, but these needs to be reviewed and approved by senior doctors to ensure accuracy. Managing this process manually can be time-consuming and may lead to delays or errors. So Gautam, how can Zoho Writer help streamlining this approval workflow while maintaining security and efficiency?
Well, that's actually an easy process, Jennifer. And for this case, we are also going to use a fillable template so that it will be easy for us to demonstrate on how to configure this. So here you can see that this is a fillable template that we are going to use. And as I mentioned, all the templates shown here are created from scratch in Zoho Writer itself. So now here you can see that I have added the patient's first name, last name, date of birth, and all the required details that needs to be filled by the lab technician. And once these informations are filled, it will just go to the senior doctor for approval. So the senior doctor can check and perform their signatures and then go ahead and store it into the work drive. So now for this, what I have to do is I just have to go to the automate tab once I have done with the configuration of the fields. So here, what I'll do is I'll just go ahead and select send responses for approval or completion. So in here, once I select this, I'll be able to configure the approver who's gonna approve this particular document, that is the senior doctor's email address. So now what I'll do is once this process is done, I'll just share this fillable template to lab technicians. So once the lab technician gets into the form, they'll just fill in the details and they'll fill in the test results that they made using checkboxes and drop downs and other fields that I've inserted. And also they can go ahead and insert their signatures as well. So just go ahead and insert their signatures and go ahead and click on submit. So once the document is submitted, it will just go to the email address which I have configured in this particular section, so that the senior doctor can check all these information submitted by the lab technician and then go ahead and perform their signature and submit the document. So this is how you can easily perform approvals for medical lab reports using Zoho Writer.
So now that we have seen how Zoho Writer helps with collaboration and streamlining data collection, let's move on to another crucial aspect, automation. Automation eliminates repetitive tasks, reducing manual errors and ensures consistency in healthcare documentation. So Gautam, healthcare facilities handle a lot of documentation. that is medical reports, invoices, prescriptions, and discharge summaries. Instead of manually creating each document, is there a way to generate them efficiently in Zoho Writer?
Absolutely, Jennifer. This is where document merge comes into play. Document merge allows users to create templates and automatically populate them with patient details, medical data, and other relevant information. This feature can also be used for generating invoices, lab reports, or even patient consent forms. By pulling data dynamically, Zoho Writer helps healthcare professionals focus on patient care rather than paperwork.
That's really useful. Automating document creation not only speeds up the process but also ensures that every document maintains a consistent format. Now, Gautam, I have a use case where ensuring that hospitals and clinics are well stocked with essential medicines is a very crucial aspect. Nurses and staff routinely monitors in inventory levels, and when supplies are running low, they need to request refills from the pharmacy. Instead of manually preparing these orders, is there a way to automate and streamline this process?
Absolutely, Jennifer. With Zoho Writer, hospitals can automate medicine order request with document merge. Inventory data can be pulled from a database and an order can be sent to the pharmacy when stock runs low, ensuring a smooth and error-free restocking process. Let me show you how this works with a quick demo. So here we have created a template which is for creating an order. So whenever the nurse gets into the inventory and when they check if they are running low of some stocks, they can just go ahead and create a merge document and send this order to the pharmacy so that they'll be able to get those information and restock it as per their requirement. So for this, what we have to do is we just have to insert all the fields from the data source, and we are going to use a JSON data. So if you have any custom data sources, you can just go ahead and use that. And furthermore, we are going to use a repeat table, and we have added the fields within the repeat region so that the row will be dynamically grown based on the number of requirement that I have. And not only that, we have also added a signer field. So as we mentioned earlier in the polls, most of you use e-signatures. So you can make use of merge and sign so that you'll be able to merge the information and then send the document for signature as well based on your own configuration. So if you have the email address of the senior doctors in your data source, you can simply click on this and insert the merge fields into the signer configuration and go ahead and send it dynamically so that the medicine order will be creating a document, and the document will be sent to the doctors for approval, and then it will be sent to the pharmacy for restocking. So now once this configuration is done, you can use any one of the format that is available. So you can send it via email or store it in work drive for later use, or even you can send it for signing process as well. So let me show you a preview and so that you'll get to know how this works. So here you can see that once I click on the preview, all the information with the patient details, the department, and as well as the number of required order is being generated. So if there are any urgencies, we have marked it as high, medium, or low based on the item name and description as well. So once this process is done, you can just go ahead and send it for signing process or to your pharmacy directly so that you'll be able to get the required information in the order.
That was a great demo on how you can send out weekly medicine orders to pharmacy. Now let's move on to another crucial aspect of healthcare operations, that is billing and invoicing. Hospitals and clinics handle multiple services for patients, from consultations to treatments, and ensuring accurate invoicing is essential. Can you show us how Zoho Writer can simplify invoice generation for healthcare providers?
Absolutely, Jennifer. With Zoho Writer, hospitals can pull patient billing details from a data source, merge them into a predefined invoice template, and generate accurate invoices in just a few clicks. This eliminates manual data entry and ensures consistency across the documents. So let me quickly show you a demo on how this works. So here is a medical invoice. So that has been, this contains the services provided for a particular patient. So here we are going to use a JSON data, that is a custom data source that we have created. This contains all these information such as the patient name and the type of services provided to this patient when the time of admission. So now what we are going to do is we are just going to generate an invoice, and for that we are going to use a repeat table so that the service line items will be dynamically pulled and the table will be dynamically grown based on the number of items that I have. So here for the quantity and the unit price, I'm going to calculate the total using the calculations. So here I have inserted a formula which is B2 into B2 multiplied by C2, so that I'll be getting the total cost provided for a particular service. And not only this, when I generate the document dynamically, the formula will also be provided based on the quantity and the unit price. So let me show you once I show the preview. And here you can see that I have inserted another formula which contains the sum of the above, so that the entire values above this particular field will be summed up and I'll be able to get the total amount. And not only that, if the user is insured, I'll also be adding a insurance formula as well. So I'm going to use the insurance coverage amount and subtract the value from the total amount in order to get the amount due by the patient, so that I can go ahead and send this invoice to the patients directly and they'll be able to pay the amount that they need to be paid. So further, what I'm going to do is I'm going to use the subtraction formula over here to get the amount that is due for the patient. And here I've added another formula referencing the table cell D5 over here, so that be able to put these amount that they owe in words. So for that, I'm going to use the format number to text. So once this configuration is done, I'll just go ahead and merge the document and send it to my patients dynamically. So let me show you a preview. So here you can see that I have a patient and all the services provided to the user is available in this section. So here you can see that the formulas B4, C4, B5, C5 is dynamically grown based on the number of line items that I have. And finally, I'm getting the sum of above, which is the total amount, and I'm also getting the covered amount by the insurance and the total amount owed by the patient to the hospital. So once this is done, you can also see that 12,543.75 is the total amount owed by the patient to the hospital. So this invoice can be easily generated and sent out to your patients who undergone services in your hospital.
That was a fantastic demo, Gautam, and I believe the attendees would have found simplifying invoice generation insightful. So now I have a use case. So when a patient completes their hospital stay, hospital staff needs to provide them with a well-documented summary of their treatment, prescribed medications, and follow-up care. This ensures continuity of care and also helps both patients and their healthcare providers stay informed. How can Zoho Writer simplify this process?
Absolutely, Jennifer. Zoho Writer makes it easy to generate discharge summaries by automating the process using document merge. We can pull patient details, diagnosis, treatment history, and prescribed medications from a data source such as a sheet file or a CRM or any other custom data source and populate them into a structured template. This eliminates manual entry errors and ensures consistency across all summaries. Once finalized, the document can be securely shared with the patient and relevant healthcare providers. Let me show you how this works with a quick demo. So here I have a discharge summary, and for this, I'm going to use a sheet file as a database. So as I mentioned earlier, you can use a Zoho Sheet or Zoho CRM or any other custom data source that you prefer. So here I have an entire patient's information over here, and not only a single patient, I have various patients, as you can see using the patient identifier. So I want all these details to be populated and to be well structured in a discharge summary. So what I'm going to do is I'm just going to connect this as a data source and pull in all the fields from the left panel into the template according to my preference. So I'm using tables and I've added everything into the document. So now all I have to do is I can simply go ahead and merge and send this to all my patients using their email address in my data source if I have any. So in this case, I'm just going to use a preview merge so that you'll be able to view the feeds, and the entire discharge summary can be checked in this case. So here you can see that I've got 10 different patients. As you can see, using the patient identifier, each patient is each document will be uniquely generated with the specific relevant information for the patient. So this is how you can easily generate documents in bulk and send out discharge summaries to your patients. So on a daily basis, if there are 10 to 15 patients that is getting discharged, you can simply make use of this merge operation and send out discharge summaries to all the patients just by a single click.
So, in the medical field, professionals and researchers frequently work together on in-depth studies. These documents require proper structuring, accurate citations, and efficient collaboration to ensure clarity and credibility. How can Zoho Writer simplify this process?
Absolutely, Jennifer. Medical research papers follow strict formatting guidelines, and Zoho Writer makes it easy to structure them efficiently with features like multi-column layouts, predefined citation styles such as APA and MLA, cross-referencing for tables and figures, and automatic bibliography generation. Researchers can maintain accuracy while saving time. Plus, multiple authors can collaborate in real time, track changes, and leave comments to streamline the review process. So let me now show you how a well-structured research paper looks in Zoho Writer. So this is a research paper document that we have created in Zoho Writer. So here you can see that there are various segments available. So there are various font sizes, and the formatting is pretty much simple in Zoho Writer. And not only that, we have also added citations into the document. So you can go to the Insert tab, and here you'll be able to create citations. So we have 3 different styles: APA, MLA, and Chicago author date. So once you click on Add New Citations, you'll be able to fetch the details from online, or you can also manually enter them and enter the citation into the document. And if you would like to just insert them into the document, just a simple click would suffice. So now that is about the citations, and here you can see that we have added multiple columns. So there are 2-column layout in this particular section of the document, and when we move further down, you can see that here it is a single column layout, and furthermore there are 3-column layout in the same document where by adding sections. So let me show you how I have configured this. So here you can see that I have added a section break, and after the section break, I have inserted a 2-column layout. And furthermore, I am ending the section break and I'm introducing a single column layout. And then I'm adding again a section break to add in a 3-column layout. So this is how you can add multiple column layouts and differentiate them using section break in the document. And as you can see, I have also added captions for the image. So all I have to do is just right click on an image and click on insert caption, so that the number of figures or the tables or even the diagrams that I insert will be automatically numbered based on the captions that I insert. And you'll also have the option to insert it whether to the above of the object or to the below. So this is how you can make use of captions to the diagrams and tables as well. So as you can see here, I have added another caption for a table. So auto numbering is pretty much simple in Zoho Writer. And furthermore, I have also added an endnote. So here I'll be able to cross-link these details to the document, and I'll be able to add more explanations in the endnote, as well as we have footnote as well. So here under the Insert tab, you'll be able to see footnote and endnote. So based on your preference, you can go ahead and insert them. And finally, we have inserted a bibliography. So for that, you have to get into the citations and bibliography and click on Insert Bibliography, so that all the citations that you have done in the document will be listed out in the end of the document. So these are the ways you can create a research document within Writer using these features. And further moving on, let's talk some highlights of using Zoho Writer for healthcare industries. Healthcare providers can seamlessly collect patient information, insurance details, and appointment requests without requiring an external form building tool. So you'll not be required to purchase any additional tools. All within Zoho Writer, you'll be able to use the forms available in Zoho Writer itself. And not only that, Writer's built-in PDF editor eliminates the need for separate tools like Adobe, allowing users to edit, annotate, and convert documents within the same platform. And Zoho Writer is an excellent alternative for MS Word. Writer includes advanced document editing, track changes, and collaboration features, making it a powerful replacement for traditional word processes. And also, when it comes to document generation, repetitive document process can be completely neglected because generating invoices, discharge summaries, and lab reports are made easy using document merge in Writer. And when it comes to signature collection, as you all mentioned, with Zoho Sign integration, healthcare professionals can collect securely signatures which are legally binding and in a consent form, contracts, or in any other critical documents as well. Well, not only that, Writer connects with Zoho CRM, WorkDrive, and other healthcare management tools, ensuring smooth data flow and automation. And furthermore, Zoho Writer adheres to HIPAA regulations, ensuring patient data security, confidentiality, and compliance with industry standards. And we also have a built-in plagiarism detection, which ensures that the research content is original and credible. So let's move on to the final topic of today's session, which is What's Cooking, where we'll be discussing about some of the new features that are yet to be released. So first, we are going to release password-protected PDFs. So currently, we have options for you to generate password-protected PDFs, but it can be copied or printed. But furthermore, what we are going to do is we are going to encrypt this and provide more security. So whenever you're sharing a PDF with your patients or with any other hospitals in order to make a transfer, they'll not be able to copy or print the material, the PDF file that you provide. So you'll be able to add an additional password. So only when you share that password, they'll be able to copy the contents in the document or even print the PDF file. And also we are providing an option to completely lock a certain sections in the document. So for now, we have options to lock content. So you can simply select the content and go ahead and lock it. Whereas we are going a step further and providing options to completely lock an entire section of the document in Zoho Writer. And also you might be aware of the PDF editor. So now we are going to go a step further and provide filling and sign capabilities to the PDF editors as well. And we are also providing some enhancements in fillable form, where you'll be able to create subforms so that when you share a fillable form to your patients, they'll be able to dynamically add rows and enter the data based on their own preference. So these are the certain features that we are going to release in the future.
So that brings us to the end of today's session. So thank you all for joining and exploring how Zoho Writer simplifies healthcare documentation. And we hope this webinar provided valuable insights into streamlining workflows, enhancing collaboration, and ensuring compliance. Thank you, everyone, and have a great day ahead.